Actually, there is a group of you here who are just fresh from surgery. Some of you who are probably about a month or so, and some of you who are 6 months, and there's a couple of longer term patients. And you all will have very different experiences. The first 6 weeks usually is hard, but it's somewhat expected because you've kind of gone through the education of it, you've gone through the classes, and you know what to expect. It's still fresh in your mind, so you're not so thrown off by certain challenges. It does get harder in a different way as you get further away from surgery. You kind of master the kind of simple day-to-day routines of what you should have, what you shouldn't have, what kind of things can get you into trouble, and what are the ideal ways of eating. As you get further away from surgery, those become second nature, typically. What does become a challenge are more emotional or social dimensions. You kind of 6 months out, a year out, back at work fully, socializing more, and you may have some short plateaus that you're all going to experience, and you will need to know that this is very normal during that first year or 18 months. If you plateaued earlier at a higher weight, you should always go back and reassess your intake, what you're doing right and what you're doing wrong. And in the class we were having ahead of you, we were talking about how calorie counting in your head is never as accurate as if you objectively know. And there are some applications, website applications like MyFitnessPal or Lose It, that if you haven't used, you should try out and make sure that you know accurately your intake. And if you are off and you are gaining weight and you are not losing the weight that you thought you should be, you go and analyze this for 2-3 days, take a look at it and see where you need to optimize yourself. If you're way below the calorific intake, you have to up it, and vice versa. If you have to trim it down, you trim it. Sometimes you may not have enough support from family, changes that come your way in life. So these are things that you have to, in life, handle. And so your coping mechanisms in the past may have been resort to eating. Now you kind of don't have that option. Addiction. We have issues with alcohol.